everyone. Thanks for tuning into A Cane on Pain. I'm Rachmi Kane, registered massage therapist. And today we're going to talk about golfer's elbow. So when clients come to see me and they're suffering from any kind of elbow pain, the first question is, do you have tennis elbow or do you have golfer's elbow? So if you have golfer's elbow, you're having discomfort on the inside part of your arm. And often clients will tell me, I don't play golf. It's just a layman's term. The medical term is medial epicondylitis, which is why we call it golfer's elbow. So medial epicondyle, mainly because it is on the medial epicondyle why you're having this problem. So you have your elbow, your big sharp elbow, and then if you come just a little bit inside, you're going to get to the next big bump. And this right here is your medial epicondyle. So all the muscles, majority of the muscles on your anterior front side, palm side of your forearm, it forms the common flexor tendon. So all these muscles, they will curl the wrist and let you do this sort of motion, and a little bit going medially deviating. So most likely for some reason, it may be the way you're typing, you're doing something, too much weight at the gym, to be causing you to have this sort of, maybe you're even playing golf and the whipping action is causing you to have all this discomfort on the inside. So what do? First thing we would do is to test if you have medial epicondylitis. So you need to have pain on touch, pain on stretch, and pain on resistance. So I would always resist a client curling their wrist up. So I'm going to put my wrist right underneath the table and curl up to see if I can lift it, the table being my resistance. And if you're having any pain, even the thought of doing that is causing you discomfort, you most likely have golfer's elbow. So what do? First thing, I'm going to teach you how to stretch. So very easy. You're going to have your arm straight out, fingertips pointing to the ceiling. And I'm going to take my fingertips and I'm going to pull them back towards me, feeling a nice stretch on the front of my arm. Another way you can do this, you could have my palms faced down and I can lean back, okay? Trying to keep my full wrist palm flat on the table, the ground, whatever you're using, countertop, and lean my weight back. If that's too much, you can just come a little bit more forward. You never want to be making angry faces. You need to always be calm, relaxed, and just breathe through the stretch, holding for 30 seconds upwards to a minute. After you've stretched, especially if you feel that the pain at the elbow is so severe, it feels like it's on fire, you want to ice. So you can grab an ice pack, wrap it in a towel, and place it on your elbow. You can grab a frozen water bottle, place your full forearm right on top of it, palm facing down, and roll back and forth all the way. Really trying to concentrate closer into the elbow, especially on this medial condyle. So when I have my hand maybe a little bit rotated so that my thumb is more down on my left arm here, I can really get it nicely into that area, going all the way back and forth. In clinic, what I would do, I would take a styrofoam cup, fill it with water. That way I can peel the styrofoam cup as the ice is melting and I have something handy dandy to hold on to. If you're using direct ice, you always want to keep the ice in motion and all there. So I'm just a little bit closer to me, where I'm icing all there on my medial epicondylitis, and my water's dripping. So when you're icing, you'll feel 4 stages: cold, burning, aching, numbness. The moment you feel numbness, you want to stop, dry off, let the area get back to its normal temperature, and you can repeat the process again. When you feel you're ready for a bit of a massage, I have with me my Yoga Tune-Up balls. There are 2 balls in a mesh bag. If you don't have, no big deal. Grab yourself a tennis ball. You can put 2 tennis balls in a sock, tie a knot on the end. I like using the 2 for this. So I'm going to take my forearm, same thing, palm down, and work back and forth. My table is a little bit too soft, so I have with me my daughter's book. And I'm just going to go back and forth, massaging all here to give myself some relief. This is why I have the 2. If you're using one, you really need to try to hold it steady because it'll be a little bit too wobbly, as I just demonstrated. If you're ready for something a bit more specific, what I would do, I have with me my massage lotion. If you don't have massage lotion, no big deal. Go into your pantry, grab whatever oil you are not allergic to. Olive oil, coconut oil, canola oil. And you're going to work all here close into that medial epicondyle. So starting from the lower part of my arm, from my wrist, and I'm going to work all the way. And any place I feel that it's a little bit tender, I'm going to stay and hold. And see, don't be afraid to sink into the tissue. You have to work past, deeper than the muscles to get into the areas that are tender. And again, calm faces. Don't do anything that's making you upset, making you want to cheer up. Back up. That is too much pressure. So I hope that gives you some relief. You keep working on that until that makes the area feel better, until all this virus is over and you get to see your therapist all back to normal again. So until next time, I'm Rachmi Kane, a Cane on Pain.